Welcome back. More than 1.5 million people deal with a cancer diagnosis every year, and it brings with it the physical effects of cancer treatments.
It also, in many cases, brings fear and emotional distress. But new at 6, Dave Delozier shows us how a new study is confronting fear with laughter.
She just said, "Nancy, I'm sorry, I have to tell you that you do have cancer."
With one word, cancer, life changes. In many cases, it brings with it treatments that can be tough, but that is only part of it.
There's so much more than just the physical part of it. There's that emotional, there's that mental, it's like a train hitting you.
It was like, the whole world went black.
Nancy Wetterston dealt with months of chemotherapy to beat her cancer, long treatment days when time seemed to barely move, and thoughts moved to where they shouldn't.
When your mind's allowed to wander, you start sometimes to not think of things that are so good.
Just this undercurrent of terror, just really flat out terror that I wasn't going to be able to beat this thing.
Dr. Ryan Spencer, an oncologist at UW Health, is focused on curing patients of the physical aspects of cancer. But to deal with the psychological challenges, he and 6 of his colleagues started wondering if the answer might lie in something as simple as to laugh.
And we wanted to be able to study if we offered people the opportunity to watch humorous movies during that time during chemotherapy that seemed to be so anxiety-provoking. Could we make an impact and improve how their day went?
For 3 years, they studied 66 patients during treatments.
Mind your P's and Q's.
Don't forget to dot the I's.
Gauging mood and fatigue of those patients when watching a comedy. Looking also at when they watched a serious movie or no movie at all.
Watching funny movies did, in fact, make their negative mood improve somewhat. It also made their fear scores get lower.
Nancy is not part of the study, but did watch comedies during her chemo treatments.
It made me think about anything but what I was going through now and what I was afraid might be in the future.
Treating and curing the patient of cancer is still the goal, but studies have shown there is also a value in the medicine of laughter.
Ned Ryerson.
Bang!
There's a lot of data that says people who feel better do better. And not just better emotionally, not just better psychologically. People who feel better actually do better with their cancer on the whole.
In Madison, this is Dave Delozier, WISC News 3.
While patients seem to react most favorably to comedies, some reported improvements watching non-comedy films. Now, doctors believe at some level, any movie serves as a distraction for patients dealing with a cancer treatment. They plan to introduce the movies on iPads to patients at the hospital in the near future.